Hello, my name is Esui Osehai, and I'll be giving a presentation on the smallpox vaccine and its history. You may be wondering, what is smallpox? Smallpox is a serious viral disease that can cause scarring and death. You've probably heard about it, not actually knowing what it is. Before it was eradicated, it was a serious infectious disease caused by the varroa virus. During the incubation period of being infected, there are no symptoms, and this stage lasts for anywhere from 7 to 19 days. During this period, the infected person is not contagious. The initial stage, when symptoms first present, lasts from 2 to 4 days. Symptoms such as high fever, head and body aches, vomiting may be present. The early rash period is when infected persons are most contagious. A rash starts as red spots on the tongue and throat. This rashes changes into sore that breaks open and spread the virus further into the body. With the infected person still has a fever from here. The spots and rash spreads to the rest of the body, starting at the face, then arms and legs, and lastly, hands and feet. For the 4 days that this early rash lasts, the skin sores eventually filled with an opaque, thick fluid that usually have a dent in the center. At this point, the fever may return and remain high until scabs forms over the bumps. After the early rashes comes the pustular rash and scabs stage. This stage lasts for 10 days. The sore becomes firm in the first 5 days, and the following 5 days becomes scabs. The infected person is contagious, and during this stage, after the approximate 10 days pass, the scabs begins to fall off with leaving behind marks on the skin. 3 weeks after the sore began, most scabs have fallen off. The infected person is still contagious during this stage as well. Once all scabs are gone, the person is no longer contagious and has survived smallpox. To combat this virus, the smallpox vaccine was made in the year 1796. During this time period, there were different forms of protecting yourself from illness. Although this was present, the way of protecting oneself from illness were not effective, and still sickness was very rampant. Different types of immunization boosting one's immune system started to come out. Was one form of immunization. Variolation is when a small amount of active matter is given to a healthy individual at a young age. Some may die, but those that live end up being immune. This was done in two ways. One way was to blow it in the nose of the young and healthy, common in Africa and Asia. The other way was through a small wound, commonly done in Europe. Vaccination was another form of immunization. This form of immunization uses dead matter of a similar milder virus. This form has the same benefits but has a lower chance of death and outbreak occurring. The smallpox vaccine was approved for use in the US around the 1800s and were put into active effect then. The vaccine stopped being produced for routine vaccination around 1971 due to smallpox being completely eradicated in the US. There are two types of smallpox vaccine, the ACAM 2000 and the Genoix vaccine. The Genoix vaccine is also known as the Amvamax and Imvamune vaccine as well. ACAM 2000 was made at the year ACAM 2000 TM, which received US Food and Drug Administration FDA approved in August 2007, but was eventually replaced by drawbacks for all smallpox vaccine in February 2008. The ACAM 2000 is manufactured by Sanofi Pasteur Biologics and Emergent Products Development, Gettysburg Incorporated. Currently, and is administered to those at high risk for deficiency like HIV and infants under 12 months. This vaccine is currently made from varroa cell found in cows, so it functions as a live living vaccine. The the genoics or AMVAX and Invamune vaccine is administered for the same reason but can be given to those 18 and older with immune deficiency like HIV. This vaccine is manufactured in Denmark by Bavarian Nordic and given in two steps. First, vaccination is done, then 4 weeks later, for the second vaccine is given as part of this type of vaccine. This vaccine uses a strain of smallpox unable to replicate itself, making it a modified vaccine. Indications of the vaccine administered are rash, fever, head, and body aches. Adverse reaction present with this vaccine are pericarditis and cardiomyopathy cardiomyopathy. Myopericarditis is a complication of acute pericarditis. Pericarditis is swelling and irritation of the thin sac-like tissue surrounding the heart. Cardiomyopathy is heart muscle di- disease causes issues with the heart pumping blood. In the clinical trial, 1 out of every million people exhibited adverse reaction. Beware of the image shown may be sensitive to some. Vaccination adverse reaction deals with the inflammation of vaccination site. The first one is a robust take. Vaccinia spreading to other parts of the body. Infection of the vaccination site. Fatal and progressive vaccinia, where the vaccination site appears to be rotting. Necrosis of the site, the and vaccination spreading and manifesting as smallpox would as well eczema vaccinia. These adverse reactions are rare but can manifest due to manipulation of the vaccination site. Being immune compromised and this being a first vaccine or being too young because other adverse reactions deals with the vaccine impacting the pregnant mother's child and resulting in the death of the fetus. Some patients counseling for administration will be screening first, then making sure to be well aware of the possible symptoms and testing for all allergies to the vaccine. Once administered, checkups and routine analysis of the vaccination site is needed. Here are my references. Thank you for listening to my presentation on smallpox and its very useful vaccine.